Awesome. Awesome.
Uh,
Well, thank you so much for joining us. We have the attendees here ready for this amazing presentation. And just for everyone on the call, and I know this was rescheduled, so apologies. This will be sent out to all alumni. So all 5,000 of you will end up getting this recording. And then we have a great way to stay connected with YouTube and YouTube Health that I'll send out towards the end. That said, Ariel, I'll go ahead and spotlight your video for everyone, and we are recording. So thank you so much for being with us. I will say that one of the big things that I had heard from our alumni conference and just in speaking with so many alumni and current fellows that they were looking for opportunities and training sessions to elevate themselves, to bring more authoritative voices out into the social media world, YouTube especially. And so we're just so thrilled to have this partnership and alignment and learn from YouTube themselves. So thank you so much for being with us today.
Thank you so much, Stephanie. And hi, everyone. My name is Ariel. So great to be here. Stephanie and I have been talking about making this a reality for months. So it's really, really exciting to be able to do this. Stephanie, do you mind presenting the slides that I sent?
Yeah, no problem. Let me grab them.
Okay, thanks. We can't present slides on our Google laptops onto Zoom. Hi, it's not my doing. But I definitely want to make this as interactive as possible. So feel free to put in the chat any questions that you may have. But while we're pulling up the slides, I'll just take a step back and help everyone understand what is YouTube Health and really what are we going to be talking about today and why does my team exist and why is this conversation so important? And one thing that I'll mention is there's a QR code that you can scan if you want to be added to our mailing list. And I know Stephanie's going to send out after as well. But when you think about it at a really high level, why does YouTube Health exist? It's really around this idea that people are coming to Google and YouTube for their health information. And we at YouTube feel a responsibility to make sure that we can provide access to the most high quality health information because we ultimately believe that when people have access to better health information, that they can make better health decisions for themselves, whether that's a doctor like yourselves, learning more about recent research, or your patients as well, being able to ask better and smarter questions. And really what we do as a team is how do we make public health really public? And kind of the line that we always think about is information is really a determinant of health. So how can we at YouTube make sure that people are getting the information that they need from voices that are credible, meaning all of you? So as we move to the next slide, if you don't mind clicking, that's me. Hi, I'm Ariel. But really, as I mentioned, YouTube is a place where people are coming to not only understand what's going on in the world or how to fix their tire or learn the best beauty trend or watch gaming content, but really understand and get their health questions answered. So here are some stats that really highlight that. But everything that we do at YouTube, and really you can't say the words YouTube and video and health without this idea of responsibility. And the way that we think about responsibility is through what we call our 4Rs. And that means that we remove content that violates our policies, and we're constantly working with experts in the space around making sure that we get our policies right. So for example, we launched an eating disorder policy where we've worked with the National Society of Eating Disorders to help figure out which content's actually really harmful and triggering for people and what is okay, and really working with the experts in the space to develop policies to then be able to remove stuff that can be harmful. Then when we think about, well, if it's like a garden and you're going to remove or take out the weeds, you need to give space and opportunity for the good to grow, which is what we do when we raise up high quality health content. We'll talk a little bit about what that looks like and feels like today. And then we also reduce borderline content that could be seen as, again, in that gray area. And then we also want to give the opportunity for people to make money, or what we call monetize their content on YouTube. So that's when the reward aspect comes in. And that's the 4th R. So as we move to the next slide, I think it's also helpful to understand, and this kind of highlights what I was mentioning before, what is our role in the public health space? And that's really around making sure that we can have the best health information that's free and easily discoverable from high quality sources. But not just that, taking it a step further and making sure that people like yourselves can create videos that make health concepts easier to understand. Because when you think about the power of video, it's really around being able to take really complicated topics and make it simple and easy to understand. So as we move to the next slide, we'll talk a little bit about what exactly YouTube Health is. So as I mentioned, we're dedicated to making high quality health information easily accessible to everyone. I also want to be really clear, YouTube Health is not a separate destination on YouTube. It's actually all of our experiences when we're looking up health content on YouTube, and you'll see, and we'll talk about it, it's actually quite different than what it is if you're looking up, for example, beauty content or cooking content on YouTube. So as we move to the next slide, I think it's also helpful to shed light on how we actually bring this to life. So we'll work with third-party experts to develop criteria or principles, and then actually incorporate those criteria or principles or thinking into the user-facing features or into the user experience on YouTube that we all see. And then we partner with the entire health ecosystem. So Andrew Weil, for example. But we also work with hospitals, startups, and then individual doctors and healthcare practitioners to help empower all of the voices in the healthcare space to use YouTube to help spread information. Okay, as we move to the next slide, as I mentioned, this just highlights the 4 R's of how we think about responsibility. So you can click through. And this is what I just spoke about. So any questions on our approach to responsibility here?
So there is a question in the chat, and I'll just read aloud. What is the role of providing disclaimers when using YouTube Health for education? What are the legalities of using YouTube Health for education? Great question.
That is a great question, and one that I get often. So I am not a lawyer, so we can't give you legal advice. But what I would do is think about, we've worked with the CMSS, the Council of Medical Specialties and Societies, as well as the WHO to develop what we call information sharing principles. And those information sharing principles actually outline the different ways that you should be thinking about disclaimers and also disclosing any potential conflicts of interests. To get really specific with you around disclaimers on videos is I would take a look at the FTC guidance, whether if you're talking about a certain product that you're getting paid to talk about, or also looking at other popular channels on YouTube and seeing how they do their disclaimers. But ultimately, I would consult a lawyer to make sure that you're in line with your not only your state regulations, but also your local regulations.
I have a follow-up question to that. So,
Yeah.
we post a lot of different things, and I think as an accredited institution, we oftentimes aren't using the disclaimers. Like, what on the YouTube side is actually taking things down within the algorithm? Like, how are you deciphering what is real and what's not?
So are you talking about in the context of like what's an AI generated video and what's not? Or are you saying like how are we taking down information like videos that could have misinformation on them?
The latter, videos of
Okay. Yeah.
misinformation.
So we have a combination of clinical human reviewers and machines that will view and vet content at scale that helps us be able to take down videos. So when you think about YouTube policies in general, it's actually even beyond the health space, right? We have different policies that we have to that we have in place, whether that's copyright or whether that's violent content or whether that's like inappropriate content that we then we have a combination of human and machines that are able to identify that content. That being said, if you do ever see something on YouTube that you think should be flagged, there is a way to do that. There's a 3-dot button underneath any video where you as a person on YouTube can flag as well. But we have a very high accuracy rate, but that is to say nothing is perfect.
that's our last question in the chat area. Ariel, if you want to go on.
Awesome. Okay, we can move to the next slide. And then here's some examples of what I mean by the health experience on YouTube and how it's actually different than, again, if you're watching home improvement content or house tour content. And what you'll see on the left is when someone types in a condition like diabetes, that there's actually a shelf of videos that show up at the top of the search results where we highlight high quality, credible content. Now, you're maybe all asking, well, what is high quality or credible content, and how is YouTube deciding what's credible and what's not? And that's where we've partnered with experts to really define what that means. And then we take those principles and apply it. The first phase of this work was really around making sure that hospitals, academic medical journals, government health authorities are showing up at the top of those search results, given that the experts published in their research that is kind of the first wave of what is to be deemed credible, and also making sure that users have the right context on who they're watching. So if you're actually watching a video from a hospital on YouTube today, you'll see that there's a box underneath that says this is from an accredited hospital. Some of the other work that we've done is around making sure that when someone is showing signs of potentially needing mental health help, that they can get it within one click or one text, which is what you'll see on the Crisis One box. You'll also see something called the Personal Stories launch, and that's the third from the left image. The reason why we launched this, and really what this is we know people are coming to YouTube to ask things like, what is anxiety? What is cancer? But people also want to understand what it's like to live with those things and get the more human questions answered when they're coming to YouTube. So that's why in the last year, we've launched what we call our personal story shelf, where we highlight videos from people like me, who I'm not a doctor, but I do have lived experience, to make sure that people can get that full human experience on YouTube. And then the last thing that I'll mention, and which is why I'm also all really excited to be here and speak to all of you, is because we've launched a program in the last year where if you're an individual doctor, a licensed nurse, or a licensed mental health professional, you can apply, get your license vetted, and be able to get your channel vetted and get into our program, which allows your videos to be eligible to show up at the top of the search results. And you'll also get a label underneath your videos that says this is from an accredited, or this is from a licensed doctor, or this is from a licensed nurse. Any questions before we move on? Okay. As we move to the next slide, this is some of the work that, I was mentioning before, how we worked with experts to actually inform the way that health content is surfaced on YouTube. So for example, when you look up breast cancer, you'll see the collection of videos, and here's snapshots of the organizations and the papers that have come out as a result of this work. We can move to the next slide. And this is also to show that we've launched these features, not just in the US, but 8 other countries, and continue to launch around the world. And then this is also, I think this is a really interesting and thoughtful example of how our team and the impact of YouTube can actually help the world. When the Ukraine crisis started, we were able to work with a doctor at Mass General who was Ukrainian, who was hearing from on the ground people in Ukraine didn't know or needed help on how to actually help with trauma, like when shrapnel was falling from the sky and people were getting injured on the ground. And this doctor was able to create videos in Ukrainian to help people on the ground on how to help wound up people and help with various issues that were happening. So when you think about maybe you get started and your video is only reaching a few hundred or even a few thousand people, those your video has the ability to make a really important impact on people, not just in the US but around the world. And I'm seeing a question that says, what is the criteria to be accepted as from a licensed doctor label? Yeah, so if you check out health.youtube, our website, you'll see that there's all the criteria listed. I won't go into all the details right now, but you can check it out.
I think what would be helpful is when we send this recording out, I'm going to send a document that will actually add you to YouTube Health's email list, as well as I'll include that YouTube Health link that will tell you how you become like a doctor or certified as a doctor. So we can make sure, again, that everyone is getting boosted to the top. So I'll make sure to include that information.
Awesome. Thank you, Steph. Okay, as we move to the next slide, this is an example of what it looks like live today if you are a part of the health features program that I was mentioning. So you'll see we have various labels for doctors, nurses, mental health professionals, and then also organizations who have one of these professions who are vetting their content. I will say this is the first time any tech company has done this. This is the first time YouTube has done this. And we know that doctors, nurses, and mental health professionals are not the only experts in their spaces around providing care. So we also hope to expand the different types of professionals that we're able to offer this to. So as we move to the next slide, this is what I was mentioning around the personal story shelf. So making sure that when people come and look for what is it like to live with X, Y, and Z condition, that we're highlighting those personal stories as well. So you can check it out. We can move to the next slide. The other thing that I think is helpful when you think about, okay, how do I get started and how do I even wrap my head around how do I do YouTube well? I think it's helpful to understand Google's the #1 search engine in the world, but YouTube's actually #2. So people are coming with these specific health questions. And, this anecdote I always think about is one of the most popular videos on the Mayo Clinic's YouTube channel is not around some crazy procedure that they do, but it's actually how to remove a tick. So people are coming and looking for really simple tactical questions in the health space getting answered. So how can all of you think about how you can answer those questions for people? And what are the questions that you constantly get in your office, in your clinics, from patients, from people that you meet at, dinner parties? And how can you answer that for people, in a video? And then if we move to the next slide, you can keep on going. Yeah, I think if you just click the arrow. So I'm going to put myself in all of your shoes. And, you're probably all thinking, okay, I'm a really busy physician. Why should I care about YouTube? And I think it's helpful to talk about how this can be really beneficial to not only your practice, but your life and your patients' lives and future patients' lives. So as we move to the next slide, I think as I was mentioning, your reach on YouTube goes way beyond the exam room and way beyond the, amount of patients that you're able to see on a day-to-day basis. It can also make you more efficient in your actual, day-to-day interactions with patients. What if you could send your patients a video after an appointment actually explaining how to use X, Y, and Z medication, or why this treatment plan is right for them, or maybe answering some of the common questions that you often get post-appointment. Sorry, the light went off here. I'm just gonna turn it back on. But all of that being said, you can also help your patients pre-appointment. So what if, someone's preparing for an appointment and they have a lot of potential worries or questions? What if you could send them a video that you created before, so then they come prepared to ask you more thoughtful and better questions? It can also make you more efficient in the context of different caretakers, right? It's not just your patient who's coming, but their caretakers. We also hear so many times from doctors that YouTube is a great way to build their personal brand. I hear time and time again how different media companies or news organizations or other, different types of companies have found doctors through their YouTube channel, which has led to more and more opportunities for them. So you can almost think about YouTube as your digital resume. As I mentioned, it really empowers your patients and caregivers to be able to come more prepared to appointments, but also leave knowing that they don't need to remember every single thing in their appointment, that they can actually watch videos after. And then, as another way to think about YouTube is, if you build up a significant audience, you can have a net new revenue stream for yourself, because if you allow ads to run on your videos, you can actually make money off of those videos, or make money off of the ad revenue that runs on those videos. As we move to the next slide, you know, I know you're all now very excited and ready to start your channel. So we wanted to talk through, how do you actually get started, and what are those first steps that you need to take? And really the first step is understanding your why. And we can move to the next slide that really helps break down, why do you come to YouTube, right? Like, what are the questions that you think about? And who are the people that you gravitate towards on YouTube, and what is their why? And then think about for yourself, what is your why, right? Why are you creating this channel? Is it to inspire patients, to think about a more integrative approach to their health? Is it to help other doctors learn some of the practices that you've learned? And, when you break that down a little bit further, we can move to the next slide. Then it really comes down to learning the different formats. And I just see we have a question here. Do the YouTube Health members have any control over the ads that appear on their site? Yes. So you can block all ads from your videos on your site. There's a Help Center article that gives you a step-by-step instructions on how to turn off monetization. And just to make it really clear, when you start your channel, ads will not automatically run on your videos. You have to apply to the YouTube Partner Program. And in order to even apply to the YouTube Partner Program, you have to have certain thresholds. You have to have a certain amount of watch time. You have to have certain standing. So if you start a YouTube channel today, or if you already have one, and if you haven't been a part of the YouTube Partner Program, ads will not run on your channel. So I can also make sure that you get the link on how you can control what ads show up on your YouTube channel, because you can also have ads show, but you can block certain categories of ads, for example. So if you don't want pharmaceutical ads to show up on your channel, or if you don't want alcohol ads to show up on your channel, you have the ability to control that. So after, you've thought about, okay, why am I creating this channel? Then let's talk through some of the different formats that you can use to help actually get that information out. So if we go back actually one slide, you'll see that there's something that is called videos on demand, right? That's like the typical videos that you think about on YouTube. They can be anywhere from, a minute plus to 3-hour long videos. These are more in-depth videos, but in the last 2 years, we've also launched something called YouTube Shorts, which is the YouTube version of what you see on Instagram Reels or TikTok. It's short form video on YouTube. And these are really great ways to get started, especially if you don't have the time right now to do longer form videos. These can easily be shot on an iPhone. And again, if you just want to get to answering people's questions, these are great ways to do that in bite-sized formats. So as we move to the next slide, here's some other formats that you can start to think about. So first decision point is, okay, am I going to make a YouTube short, and am I going to make a video, a classic YouTube video? Then once you figure out, am I going to do a short or a classic video, there's other different formats that you can think about to help get your information across. So things like quick tips and tricks, right? Like 5 things you should know about X, Y, and Z disease, or doing a quick question and answer format, right? So what are the, having someone sit with you and actually ask you questions. We even see some of our creators go on the streets of their local city and have people ask them questions, and they actually film it. There's also a format called explainers. So actually giving a deep dive explanation of what is a specific topic. I also see 2 questions. Is there a fee to be a part of YouTube Health? No, there is no fee to be a part of YouTube Health. So as long as you want to create a YouTube channel, you can start creating today. You can start posting. And then once your channel meets the criteria, which is to apply for those health features, you can do that, and it's completely free. I see another question. Can these videos or shorts be posted on LinkedIn? Yes. So you can use something called the YouTube Embed Player, which is the free way to embed, or almost like be the pipes to bring a video from your channel and be living on your website, or living on different social media channels, including LinkedIn. So next slide. The other thing that I think is helpful to think about is what formats work really well on YouTube already that maybe aren't in the health space that then you can adapt to make work for the health space. So here's some examples of, GQ has a whole series of meteorologists breaking down natural disasters in movie and TVs. That has evolved to in the health space where different therapists react or break down different common movies or sitcoms, and what does it look like from, the therapist or psychology point of view, or even having experts break down different topics in varying different levels of difficulty. So breaking down the COVID vaccine, for example, and explaining it to a 5-year-old, explaining it to a college student, and explaining it to your, elderly, uncle or grandparents. Those are different formats that you can take and adapt for the health space. The last one is specifically around lists or different warning signs or different, using lists as a way to get information across. So the next slide, so once you've figured out your why, you've then figured out, okay, I'm going to start with a few different types of formats, or maybe just start with one format and post a few videos and see how it goes. The other piece of the puzzle is really making sure that whatever you create is going to be as discoverable as possible. So the way that we make sure that your videos are discoverable on YouTube are paying attention to things like titles and thumbnails. So what's important in making a good title is actually getting at what is your video talking about? What is the question that someone's coming into YouTube and actually typing in, and how is your video going to actually answer that for people? So here are 2 examples of doctors that are on YouTube that have really great, clear titles and really clear thumbnails. And what makes a really good thumbnail is making sure that it's readable. So most people are watching YouTube on their phone, or the fastest growing TV screen that we see is actually on the fastest growing screen that people are watching YouTube on is actually their TV screen. I already gave you the end of the question, but so what that actually means is you want to make sure that when you're creating thumbnails that it's readable from if you're going to watch something on your phone or if you're sitting on your couch and watching it on the TV. So you'll see in both of these thumbnails, the text is really clear and it's really easy to read and understand. And then once you create your titles and your thumbnails and you've packaged up your content in a way that is really approachable and really helping people understand what your videos and what your expertise is about, it's really important to think about how are you going to get people to actually watch your videos? Because if you think about different social media platforms, YouTube operates fundamentally differently than Instagram, right? For example, or even TikTok, where Instagram and TikTok is a more leaned back experience where things are constantly being fed to the user, versus YouTube where there's something that's being fed to you, but there's also a big search element. And the thing is, on YouTube, it could be, and it is harder to get started on a platform like YouTube, but your content never goes away. So you're able to use your content, or even if you create a video today, it could be valuable to someone in 3, 4, 10 years. We see this time and time again where videos become or resurrected from years ago because the topic becomes relevant again, or because it's really helpful. So when you're thinking about posting, it's also important to engage people on how video itself is actually going to get viewership. And another way to think about that is understanding the search trends that happen on YouTube and on Google. So there's actually a free website called Google Trends where you can type in any term and you can see what concepts or terms are actually trending and how they've trended over time. So that's a great way to understand what should you be talking about and how should you be framing things. You can also see in the Google Trends website what's the top trending terms associated with those terms, what's rising. So another great resource to help you really refine, okay, what am I going to create and why should I create it? But when we think about engaging your audience, we'll just go to the next slide. There's also some really easy ways to get people to engage with your channel and your brand and your video. So, one way is specifically commenting down below, right? Commenting on the video, asking people, what do they want to see? What did they like about the video? What are the questions that they have? There's also something called the community tab, where if there's weeks where you're not posting, for example, that you can post polls or questions and engage your audience in that way. And then also, if you have followings on other platforms, whether that's LinkedIn, whether that's Instagram, whether that's TikTok, you can actually link and drive people to watch your videos. Now, I see some other questions that I'll address. So how much are trolls or bots a problem with these videos? Trolls and bots are a problem, I would say, like across the internet, but YouTube has a lot of different measures in place to detect those types of accounts and actually shut them down. Karen asks, information changes as studies are published. How do you edit or remove information that's no longer accurate, or how do you date things to protect against inaccurate information? That's a great question, and we saw that a lot during COVID. So what you can do is a few different things. One, making sure that when you publish the video, everyone can see the video publish date, but you can call attention to, at this time in 2023, here's what the research says. And you can also update the descriptions of videos and also put clearly in the descriptions, this video was created on, X, Y, and Z date, and this is what, is the latest. But there's ways to go in and also, add to the video or edit it to make sure that it is up to date. But, I think it's a situation that hits everyone. So I would say first things first, like being really clear on when the video is published and what the information is you have to date. And then, this, you can check out health.youtube to learn more about what the team does. You can also see our health features application there. And you can scan this QR code to be in touch with our team, because we're going to be starting to send out more regular newsletters. And we're also going to be starting to do more regular open trainings for people who want to come and learn things like, how do I do shorts really well? Or how do I do live streaming really well? Or how do I think about things like alternative monetization? So if you don't want to make money through ads on YouTube, there's actually other ways that you can make money through things like, we have a channel memberships option where someone can become a member of your channel. So check out that website and scan that QR code so we can be in touch. But I'll pause here and want to leave some time for Q&A.
Thank you so much. That was awesome and great questions. I'll be sending, like I said, the recording around, and feel free. Luckily, I've had such a great relationship so far with YouTube Health and Ariel, so we can always get questions back to her. But yeah, thanks again for coming, and we'll give everybody a couple minutes to kind of think and digest questions. If you want to brainstorm or anything like that, let us know, and because that's what we're here for. Looks like we got one.
There are ads on my video. How does that mean does that mean I somehow accidentally allowed them? How do I block them? Yeah, so I can send through Stephanie the link that you can use to block ads. I will say, even if you do block ads, there is potential for sometimes ads to show up, because that's just a YouTube wide situation where YouTube about 2 years ago made an announcement that they will run ads sometimes, even though you choose to block them. So if you don't want ads to block, the best thing that you can do is, block your ads and turn off monetization. But again, there is, in, some cases, ads will show, and that's just the case for everyone. Is the licensing for YouTube Health not available for physicians' assistants? For right now, PAs are not a part of the program, but again, we're hoping to be able to expand that in the next few months to a year. Someone asked around some thoughts on Vimeo versus YouTube videos. So, when you think about user behavior, right? YouTube is the largest video platform in the world. People are coming to YouTube to look for information. Vimeo is a great platform, but I don't know how large they are and how many people are going to Vimeo first for their videos. But when we think about the power of YouTube and people coming to YouTube, on their own, that's how I would start to think about it. Vimeo, we often see in more of like a B2B setting. But again, definitely explore what works best for you and your specific needs. If a more B2B approach is something that you're interested in, meaning you don't want to have a public YouTube channel and you want to use videos to help patients in the moment, or create a QR code and create a playlist for patients, or send an email out and have, a playlist. You can also do that on YouTube. So you can make your videos private, which means either no one can see them or only specific emails can see your videos that are private, or you can make a video unlisted, which means only people who have the unlisted link can actually see your video. I hope that answers some different ways that you can think about your channel. Any other questions?
I have one, just the trainings. Oh, I don't know if someone else, the trainings that you mentioned, did you say they already existed or that they would be coming?
So they're going to be coming. We are going to be launching something before the end of the year that is almost like a podcast series, but it's on video, where we brought some of our top creators and they actually talk about how they got started and the different tools that they use. So that will be launching in the next few weeks, which I'll also send you. But then the more live channels, the more live trainings are things that we're going to be rolling out in the next year.
One more question hit the
Yes.
chat.
If the requirement is 2,000 hours of watch time and we're starting a new channel, how can we become YouTube verified? So that's where you'll have to start your channel first and actually start posting to get those 2,000 watch hours. The reason why we have those 2,000 watch hours is because in order for our teams to do vetting on your channel to make sure that you're in good standing, we have to show that there's history of you posting on YouTube. But yes, step one would be to create a channel and start creating videos. So then you can get to that 2,000 watch hours.
I would also say, just for everyone that's on the call and for those who will watch this later on the recording, if you're putting time and effort and really focused on your YouTube channel, please share it with us, share it with Kayla on the alumni team, share it with Nick on our social media side. We would love to amplify your voice as well, share it on our own platforms and help elevate your voices as well within our own community. Just within the emails and the audience that we speak to every day, it's about 62,000 people or so that we're communicating with on an ongoing basis. So just know that you have such a partner in us to help bring those hours to you so that you can get to the point of those 2,000 viewable hours.
And I'll also say you have a partner in YouTube Health. Just like Steph said, we want to work with you all to make sure that you feel like you're set up for success on YouTube as a platform, because we want people to get access to expertise like yourselves, and want to make sure that you all feel, again, set up for success and empowered, that you can get the right tools to be able to be successful on YouTube.
Well, thank you again so much for joining us, and thanks for everyone joining and all of your thoughtful questions. Again, this is going to be sent out to every alumni, so look for this recording to come in the next few days for you to review. And if you ever need anything, my email is Steph, STEPH, the letter F like Frank, at arizona.edu. If you have questions or you want to see more things like this, or you want us to elevate your YouTube channel, please reach out. And before we go, we have one last question.
Do we need to get credentials approved first before creating a video? So no, you can start a channel today and post videos. The credentials and your license information only matters when you hit that 2,000 hours and when you apply for the YouTube Health features.
I'd also just give open permission to say I'm a alumni, I'm a graduate of the Andrew Weil Center for Integrative Medicine. Like, you want help writing descriptions or things like that. Again, it only helps the center, in the long run, thinking of from my point of view, but also from just our reach in as integrative medicine and getting that out there to the world, use us in any way that you can. We are the institution, but honestly, we're there to help support you. You went through the training, and ultimately, if that helps you in your descriptions or to get found, please do it.
That's such a great point, Steph, too. I feel like you keep making points. And then the other thing that I'll say is like writing your descriptions, scripting, titles. You can also lean on a lot of the AI tools that exist. We're hearing a lot from creators how that's helping them speed up their production process. So don't be afraid to also experiment with some of the tools out there to help your lives be easier as you're getting started.
Yeah, great point. One of the tools that I use is Canva. And so when I was working with Ariel, she said, you know what, your thumbnails, the main image that everyone sees, nobody can read those titles and they're going to scroll right past them. You need 1 word, 2 words at the most, then focus on the descriptions and then the other things and keywords. So I will say, I'll just shout out Canva. It's you can use it for free. They have YouTube thumbnails already pre-sized and pre-formatted, and you can add in your own pictures, and it is one of the simplest tools to use to kind of get you up and running. So I'll just kind of put that out there, that was something where, I didn't want to bother my designer who's very busy doing other things. I wanted to be able to do this immediately. And so that was like a huge change. I think you would see how much more organized, use our page if you've seen it before and now see it. It's much more organized and it's easier to find Body of Wonder versus any of our meditation videos. And, we're really shouting out, 1 to 2 words out there so that we aren't getting lost in the scrolling. So Canva is a great tool to use to get you started with those thumbnails.
Yeah, I love that example, Steph. I think Canva is such a powerful tool. And the other thing that I'll say is if you do have patients who are multilingual, we have a free service called Aloud that will dub videos for you in Spanish and Portuguese, and we're rolling out more languages. And then you can upload that dubbing onto your video when you upload a video and use something called the multi-language audio feature. So if you do want to upload videos that are in English, but you want to be able to reach other audiences who speak other languages, there's also a free way to do that using AI.
Yeah, I'll share my email again. I think it might be easier if I just put it in the chat. And like I said, I am our senior business development director here. So I oversee marketing, admissions, and then strategic partnerships with things like YouTube Health. So please reach out. I'm always interested in hearing from alumni and hearing what else you guys want, and we will make it happen. Thank you again so much to YouTube Health and helping us elevate the voices of these incredible physicians, physician assistants, NPs, all the people who have trained through us. It's so appreciated, because we also want to know how to cut through the noise and help people. So thank you again for being with us, Ariel, and I will hit you up with my notes of all the things that people wanted to see in the follow-up recording.
Sounds great. And thank you all. And thank you all for all that you do for the world and for people. And I'm so looking forward to seeing you all on YouTube.
All right, everybody. Thanks again. Bye-bye.